Okay, hello for a second time today. I was looking at these reports in the last video and I got cut off by my wonderful camera. It decided to stop recording. But these are the WHO situation reports, which you can easily Google. And here's the situation reports front page, and we're on situation report number 22, which is going to load up. And it says no new countries have reported cases in the past 24 hours. As I mentioned, you get a nice little summary at the top, which shows up nicely on your phone actually. If you are using a phone to view this web page, it's got the map with the blobs, most of which are in China, of course, which are not really to scale. Okay, I mean, these dots in China are all of a similar size, but actually there's about 25 times the number of cases in Wuhan, in Hubei province, than there are in any of the others, and the biggest dot there is only just a little bit bigger than the others, so it kind of looks like it's more spread around the world than it is. It's still extremely concentrated in Wuhan. Probably about 2/3 of the cases are in Wuhan at the moment. Okay, and as I mentioned, you get a nice city breakdown, a breakdown by city. 31,000 cases in Wuhan, 42,000 in China, 43,000 in the world, 395 outside of China. So only just under 1% of the cases are outside of China. 1,017 deaths. This was the first day. This was yesterday's data, when tragically the death rate just went over 1,000 for the first time. And you can see here that basically the daily rate of change and the actual numbers of cases. It's really simple to read. And then you get the city breakdown, okay, with Wuhan, of course, at the top, dominating it completely. Hubei province, which is where Wuhan city is, and then Guangdong is second, with about 1,170 cases. So there's about 20 times as many cases in Hubei, about 30 times as many cases as there are in any of the other regions, something like that. Beijing in the 300s, Shanghai just over 300, and so on and so forth. And then you've got a country breakdown, okay, Singapore, Japan, Malaysia, all basically in the teens and the 20s, and you've had an increasing number of countries, of course, as time has gone on. We've got 8 cases in the UK now, as of last night, 11 in France, 14 in Germany. The international conveyance, the ship in Japan that's moored, the number of cases has just doubled in a single day. It's gone up 65 and it's now 135 cases. That is very bad. I wouldn't want to be on that ship. I really do feel for the people who are on that ship. And then you get some graphs which for the basically the out of China foreign cases, which I mean, they're sort of much of a muchness. I'm sure some technical people would like to see those, but they're not fantastically interesting. What I really want to find out is it a pandemic or what? So I've done a spreadsheet, and the spreadsheet is there. And this took quite a few hours to do, but I've done it basically in an afternoon and an evening. And so I've got data now, 21 days, 22 days of data for the total number of cases, the new cases, the factor of the increase in the cases, the percentage change, some logarithmic stuff, the Chinese cases, the Chinese new cases, the world cases, the world deaths, the severe cases and the rates of change, and the deaths going from 6 3 weeks ago to 1,017 now, and again with the rates of change. And I've also got some data from Hubei, from Wuhan, okay, and from some of the cities, just basically from Guangdong, Beijing, Shanghai, and from a few countries, Japan, South Korea, Thailand, Singapore, USA, France, and the Japanese ship, which is unfortunately moored, and the cases are absolutely burgeoning, gone from 70 to 135 between over the last day, basically, which is terrible. And then I'm looking for trends, okay? The whole point of this is to look for trends and to see if we can do any kind of prediction, any kind of forecasting from this data. So I started doing some crude graphs, okay? Total cases, severe cases and deaths. Tried fitting some trends. I think it was on Chris Martinson's website. The parabolic trend fits the data very well, which is really quite odd actually. An exponential trend doesn't fit quite as well. Let's try an exponential trend. Okay, hope you can see that. An exponential trend doesn't quite fit, but the forecast of an exponential trend goes to the moon, basically. This was from the first 17 days data. The parabolic trend actually is much better. The parabolic trend tells me that by now there should be 40 to 50,000 cases, and actually this is from the first